Good afternoon, and welcome to our series of webinars focused on bringing you information about COVID-19 related topics. The information in these weekly webinars is geared toward long-term care and skilled nursing facilities, but we encourage everyone who's interested to attend. Today, we'll be discussing the bivalent booster timing and approach to vaccines following respiratory illness. Everyone has entered the meeting on mute, but we will have a discussion at the end of the webinar. If you have questions or comments, please submit them using either the chat or the Q&A tool in your Zoom menu. We encourage you to join us every Wednesday for more of our weekly webinars. Next week, we'll be discussing appropriate use of PPE under the latest guidelines. My name is Kathy Caudill. I'm a communications specialist with Quality Insights, and now I'd like to introduce our guest today, Jennifer Brown. Jennifer is a quality improvement specialist and infection preventionist at Quality Insights. She is a registered nurse with over 10 years of experience in a variety of healthcare settings, most recently serving as Director of Staff Development and Infection Prevention in Long-Term Care. She has also led several quality improvement and infection control initiatives in acute and ambulatory settings. Jennifer, welcome back, and thank you for joining us again.
Thank you so much, Kathy. Good afternoon, everyone. In today's webinar, we'll discuss the approach to vaccines following respiratory illnesses. During these winter months, respiratory illnesses are common, and it's important to stay up to date with all recommended vaccinations, especially the updated COVID bivalent booster. Today, we'll talk about how to approach vaccination when respiratory illnesses are prevalent in your communities and when you have recovered from a respiratory illness. So speaking about COVID-19 vaccines and boosters, COVID-19 vaccines are a safe and effective way to help protect against severe COVID-19 infections, hospitalization, and death. Although it is possible for those who have been vaccinated against COVID-19 to contract the virus, those who are up to date with boosters are much less likely to experience severe symptoms than people who are unvaccinated. Who is eligible for the bivalent booster? So adults who have completed their primary vaccine series and who have received their last COVID-19 vaccine dose at least 2 months ago are eligible for the bivalent booster. Currently, there is no recommended waiting period between getting a COVID-19 vaccine and other vaccines. Individuals can get a COVID-19 vaccine and other vaccines, including the flu vaccine, at the same visit. For individuals who have recently recovered from an acute illness, there is no need to wait to receive the vaccine after the illness has improved. As soon as the symptoms have improved, you are eligible to get the vaccine. If you recently had a COVID-19 infection, if that's the infection that you're recovering from, you may consider delaying your next vaccine dose, whether a primary dose or a booster, by 3 months. Certain factors could be reasons to get a vaccine sooner rather than later, such as personal risk of severe disease, risk of disease in a loved one or close contact, local community levels, the most common, COVID-19 variant currently causing illness in your area. These risk factors should be discussed with your healthcare team, but in general, those at high risk for serious COVID illness should not wait for 3 months to get their vaccine. However, if your healthcare team determines that it is best to wait, 3 months should be counted from when your symptoms started, or if you had no symptoms, it would be from when you first received your positive test. So what if the vaccine that you had for the original series is not available? The CDC does not recommend mixing products for your primary series dose, but if you receive the Pfizer, BioNTech, Moderna, or Novavax for the first dose of your primary series, you should get the same product for the following primary series. If those are not available for your booster, you can get another mRNA vaccine for the booster. For those who are immunocompromised, there are special considerations as the immune response to COVID-19 vaccines may not be as strong as those who are not immunocompromised. What makes someone moderately or severe immunocompromised? Some people have a weakened immune system due to a medical condition or because they are taking immunosuppressive medications or treatments. Some examples include, but are not limited to, active treatment for solid tumor or hematologic malignancies, currently taking immunosuppressive therapy after organ transplant, advanced or untreated HIV infection, or active treatment with high-dose corticosteroids. If you're unsure about your condition, make sure to discuss how COVID-19 vaccines will affect your specific medical condition with your healthcare provider. For those who are moderately or severely immunocompromised, a third primary dose may prevent serious and possibly life-threatening complications from COVID-19. The third dose is not a booster dose. It is included in the individual's primary vaccine series. Once the primary vaccine series is complete, you should get one updated bivalent booster using Pfizer or Moderna if it has been more than 2 months since the last vaccine dose. You will be considered up to date with your COVID-19 vaccines immediately after getting your updated bivalent booster. Does anyone have any questions?
All right, so in a minute, we'll begin the Q&A. If you have a question or comment, please share them using either the chat or the Q&A. And you can also raise your hand if you would like to be unmuted to be able to audibly ask your question. And while we're waiting, I'd again like to invite everyone to next week's webinar, where we'll be discussing appropriate use of PPE under the latest guidelines. That will be next Wednesday at 2 p.m. And if you ever want to talk further about these topics, but prefer a one-on-one discussion, we invite you to join during our office hours, which are each Tuesday at 8 a.m. and Thursday at 2 p.m. The office hours are kind of like a chat room, but they're live, so you can drop by and someone on our team will be there to answer your questions. You can find the links to those live chats and our webinars in the newsletter we send out each Friday called the Last Minute Lowdown. If you'd like to receive that newsletter but don't think you're on the mailing list, you can email me at ccaudill@qualityinsights.com and I'll get you on the list. And you can also contact Jennifer Brown if you have any questions about today. And I'll drop our emails in the chat shortly if you have any questions. And in addition to talking about today's topic for the webinar, we would also like to know if you in the chat or the Q&A, what challenges that your nursing home is experiencing when it comes to giving the bivalent. So if you are having troubles with getting a supply, if you're having trouble getting consents, we would like to hear about that and maybe discuss it today. Let's see. So we have a question here, Jennifer. It says, curious if most people are delaying the bivalent booster for 90 days post-COVID illness. Actually, that might be a question for the group.
So that has been some feedback. That's why we wanted to really get that information out, that it is not generally necessary to do that. And I'm not sure if anyone else on the team has heard different reasonings or why they may be delaying the COVID-19 booster, bivalent booster, but you know, it's important, especially if the individual, you know, in high risk groups, including those in our skilled nursing facilities who have a high risk for COVID-19 infection, get that booster as soon as possible in most cases.
So we've got some comments in the chat, some of it regarding respiratory illnesses. So Penny, who is by the way, she's the head of nursing home team lead here at Quality Insights. She says, for nursing home providers on the call, are you seeing a lot of other respiratory illnesses? So please drop in the chat if you are seeing a lot of other respiratory illnesses. Kate says they are experiencing staff pushback. How are others dealing with this? Christina says, no, I hear the hospitals recommend to give it after 30 days.
Mm.
She also says, yes, there is vaccine fatigue and difficult to get staff boosted with the bivalent.
So, hi, this is Penny. It does look like a lot of you are hearing, and I think that's kind of what we heard when we were talking to Jennifer, as far as post-COVID, probably not waiting the 90 days. So it's good, kind of good to hear that you are getting that information, that, you know, probably 30 days out, because it is important. Oh gosh, vaccine fatigue. And Kirsten, thanks. Para-influenza and rhinovirus, because I know every time I turn around here, and I live right in central Pennsylvania, friends, family, kids, grandkids, everybody seems to be going through some respiratory illnesses, which I know, and that's another thing that Jennifer was addressing, because there's so many respiratory illnesses going around right now. Just, you know, once you're over those symptoms, just being able to go ahead and get the bivalent vaccine, and you can get your influenza shot at the same time. Vaccine fatigue. Wow. We are hearing that a lot. Just you know, we're developing resources related to that, but anybody on the call, have you had success in addressing this with your staff in any way? Any best practices that anybody can share? You can either chat in, or if you do want to, I think if they raise their hand and they want to make a comment, can we open that up? Yeah. Yeah, we're really interested in getting the feedback from all of you. As you know, last week I talked, if you were on the call, on the webinar last week, I talked about how the White House is really pushing everybody. They're really looking at nursing homes and making sure that you're getting the bivalent vaccines out there. And that's what all of this is. And that's sort of why we're trying to get this information out there. We're trying to hear back from you what your challenges are, trying to come up with resources, ideas, best practices that might help with this sort of thing. I know that vaccine fatigue is very real. People are also seeing intense reactions from staff and other residents. Can anybody speak to that? Jack, I know you were on a call before, and you said, I think you did let us know that some of your residents who were getting the bivalent vaccine were actually having reactions. I'm curious if others are seeing that, if there's a large percentage having reactions from the vaccine.
Just a quick question. Is the reactions symptoms? What type of symptoms are they having, if so? Because this is the first time I've heard, you know, the severe, usually the reactions are similar to the reactions in the primary series. So
Jack has raised his hand, so I think we're going to allow him.
Yeah.
Let's see. I've allowed you to unmute yourself, Jack.
There we go. Can you hear me okay?
Yes.
yeah,
Thank you,
Jack.
We had it, we did a clinic right after Thanksgiving, and then I did one last week. The one from last week, I've got a couple nurses whose arms are still swollen and red. With really, really swollen and very large circle, more than I've ever seen with any flu shots or anything to that. Also, we saw fevers in the high 100s, 102, 103, respiratory distress, intense fatigue and malaise, way more than we've had with any of the boosters in previous series, and way more than the flu.
Jack, can I ask how long some of those symptoms are lasting? Like the high fever, the
High fevers usually within 24, 48 hours.
Mhm.
I see for the injection sites for some of the nurses, I gave it on Friday, which is the 9th, and I just saw one of them today. That's still very discolored, very red, and a little painful. Swelling has gone down. Respiratory distress was like 3-4 days for the residents. So a little bit longer than like we expected everybody to be Saturday, maybe Sunday, and be over it. And the week we had given it to like a lot of residents, like 75 residents, it was like middle of the next week, and we were still trying to get fevers down.
Yeah, so it's going beyond that 24 to 48 hours that some of us experienced with the previous vaccines. What can you tell me if it's Moderna or Pfizer?
Pfizer.
Pfizer. Okay.
Exactly. That was the other strange part.
Yeah.
Yeah, thanks for sharing that. Typically, we do see, pain and swelling at the injection site and fever, but that is not typical. Yeah. So
And
thank you for
Rebecca
sharing.
shared she herself had that redness swelling. Wow, up to 10 centimeters, and you were Moderna. Okay, that's interesting. So it seems to be, and I have heard from a couple other nursing homes who said the same thing, that there were some reactions from this. So wow, okay. That's something we definitely will make sure that we're sharing in our responses to CMS also and CDC.
Mhm. Yeah, I see also in the chat, from Cindy Wandling, one of our QIS here, any recommendations for facilities with short-term stay patients, 7 to 14 days, who simply don't want another shot or want to wait until after discharge to get the booster? Any successes? So my recommendation is to definitely have that booster either on discharge from the hospital or during your short stay, because while you're recovering from the illness, it is very important to make sure that you protect yourself against COVID-19, because you don't want to have COVID-19 on top of whatever is the reason why you're in your short stay at the facility. So definitely, make sure that residents in your short stay facilities are protecting themselves against contracting COVID-19. Make sure they're up to date with their boosters. Has anyone had any successes in encouraging their short-term stay residents to get the booster?
While we wait for more responses, I'm going to drop your email and my email in the chat like I promised earlier that I would.
There we go. There's a slide as
Yeah,
well.
there's your contact information.
Okay.
All right, what do you say we wrap up?
Okay.
All right, wow.
Well, thank you
Yeah,
so much.
we will.
closing show notes here. Okay,
Yeah,
go ahead.
before we do wrap up, Kathy, we will definitely, has all of us, the quality improvement specialists here at Quality Insights, interact with our nursing homes across the states, and both states. When we talk to nursing homes, we'll talk to them, bring up about the vaccine fatigue, and if we can come up with any best practices, any ideas, we will definitely share that with everybody. We'll be sharing, we'll try to develop a resource of best practices for how to deal with vaccine fatigue. I know we have some resources out there, encouraging people to get the vaccines because of adding that protection, that extra protection, especially when you're working with our population who can have some of those risk factors due to age, comorbidities, that sort of thing. But yeah, we will talk to others, and we will definitely make sure that we're getting those resources out there, especially related to the vaccine fatigue.
All right. Well, if you guys are ready, I think we can wrap this up. I'd like to thank you all for joining us today. If you have any further questions, like I said, you can email me, you can email Jennifer. I'll also be emailing a recording of this webinar later this week to the emails that you registered for this webinar with. I'd like to thank you again for joining us all today, and we hope you can join us again next week. And